Hello, my name is Stacy Kasianchuk, and I am Genev's Senior Director of our dietitian team and our nutrition and lifestyle care offering. And so today I want to share with you the details of our nutrition and lifestyle and weight management pathways in our care model as a part of Genev and our menopause care to provide you with better understanding of the care that we provide our patients and the health journey that they come on or that we go on with them in this process. All right. So first here is our clinical leadership. So you see first Dr. Rebecca Dunsmore-Sue is our Chief Medical Officer. And I, as I mentioned, am the Senior Director of our dietitian team and our nutrition and lifestyle care offering here at Genev. And what I'm going to take you through and show you is the collaboration in care that we provide between physicians and registered dietitian nutritionist and how that works to support patients going through their menopause journey and the approach that we have around that. So here is our clinical care team. This is not pictures of everybody. So if you can do the math, we have currently 12 dietitians on staff, including myself, and 42 OBGYN physicians, including Rebecca. We are all trained in menopause care, and so these are some of the individuals that your patients will be seeing for their care, but really to show that we are a growing team, and we're continuing to hire to meet the demands of the patients that are seeking care across the country. But here is our current status as of right now at the start of 2026. So here, what I want to start with is just giving some groundwork, some framework around Genev's menopausal care model. So it is a collaboration in care, and as we are seeing patients with that are experiencing the menopause transition, we see the benefit to providing the option for medical treatment. So whether it be hormone therapy or non-hormonal therapies or review of other medication options in combination with nutrition, metabolic health support. And ultimately, we want to help them feel better in the moment, improve their quality of life, but then also support their long-term health outcomes and that not only their lifespan, but that health span that they have. And the potential to do that is really important during this perimenopause to postmenopause transition period. So here you see that combination here where we have our registered dietitian nutritionists, our Menopause Society certified and member physicians, and really wanting to put that care in where we establish an initial appointment with ideally each clinician, and then subsequent visits to continue to check in, follow up, and support the engagement in lifestyle and nutrition changes, as well as that medication management where appropriate. So our goal is really to deliver coordinated, patient-centered, evidence-based care, bridging that medical management and lifestyle care change. So this is a unique model that we bring to this space, this menopause space, where we are taking OBGYN physicians and registered dietitian nutritionists together in that collaboration. So here today, I'm going to, in this presentation, talk more specifically on the dietitian care, so you have a good understanding of what can we see patients for, how are we working with them, what does that patient journey look like. So generally speaking, and I will say this is not an exhaustive list, but I would say this covers a wide span of things that a peri to postmenopausal patient may come in with that deserves dietitian care, deserves nutrition, counseling, and support. So menopause symptom management, there are a variety of menopause symptoms that can be better managed or mitigated by nutrition and lifestyle interventions. Now, the nutrition and lifestyle interventions may not completely eliminate the menopause symptoms, but certainly can help to mitigate and help individuals to start feeling better in their bodies at a time where they just aren't. And that can be part of that care that they're receiving. Weight management, weight gain, and changes in body size and shape is a major concern of patients going through this position. Is one of the top concerns that we hear. And so nutrition and lifestyle plays a role in that. And so we can certainly help in that regard. And then metabolic health, prediabetes, hyperlipidemia, cardiovascular disease, these are all conditions that have a strong link to nutrition and lifestyle. And so if someone has any of these health concerns, or could even be a family history of these, which genetically may predispose them to being at greater risk, targeting and evaluating their current nutritional lifestyle strategies and having support and implementing strategies that can improve that are key aspects to their ultimately improving that overall health and quality of life. And some individuals know what they need to do and they need the support doing it. Other individuals don't know where to start. And so we can target both of those components. When we look also at gastrointestinal conditions or concerns, sometimes during the menopause transition, digestion changes. There might be sensitivities or intolerances to food that didn't exist before, or just certainly wanting to optimize and improve digestion. That's something that we can help with. Optimizing nutrition for exercise. If someone is wanting to make sure that they are adequately fueling their bodies for their exercise routine, that is important, especially if someone is just starting off exercising. If they've never done that before, then that is something that they want to make sure that they have adequate fuel to do that, the appropriate amounts at the appropriate times. That's what we can support with. Sometimes individuals, especially during perimenopause, may experience anemia if they have irregular bleeding patterns with their menstrual cycles. Certainly, that also deserves medical attention. That is not a nutrition component alone. But with that anemia diagnosis, certainly we want to also be paying attention to where nutrition and potentially supplementation can play a role in getting this person back to a healthy state, in collaboration with a physician treatment and examining some of those menstrual concerns, menstrual bleeding concerns that they may have, if that's the root cause of the anemia. Certainly there can be other things, and it's not out of the realm of possibility that someone may experience anemia and need to evaluate the root cause of that, and then also the nutrition interventions that could be helpful. Oncology nutrition, so whether that is someone that is a cancer survivor or currently undergoing treatment, or cancer prevention. Certainly individuals, especially if they're at higher risk for cancer and have family risk factors, or is a situation where they just want to make sure they're optimizing their health, we can talk about the nutrition lifestyle components to that. Finally listed here is bone health, and this is certainly a nutrition component as well as an activity, physical activity, movement component. And this is an area too during the menopause transition with that decrease in estrogen. There's a less support to support bone building, and we do know that bone building in the to postmenopausal phase is very difficult to do, if not impossible for most individuals. But what we want to do is slow the pace of that bone breakdown and decrease the risk of fracture, of falling, making sure that there's adequate nutrition there, so we don't speed the process along. Nutrition and lifestyle can play a role in that. So here is, like I said, many of the things that patients come in for, we are prepared to assess and work with them on in addressing. This, again, is not an exhaustive list. There might be someone that just wants support on nutrition and wants to learn more about it, and that's absolutely fine too. Or other another one up here to kind of related to gastrointestinal conditions, but could be even food allergies or food intolerances that we might be able to specifically address if they don't know where to go or how to address it. So our appointments are 45 to 55 minutes. So our initial appointments are 55 minutes, so close to a full hour that we take with the patient initially to really dive in and learn about their questions, their concerns, and their goals. And then those follow-up appointments are 40 minutes each. And I will, and further along in the presentation, go through the specifics of that patient journey, so you have an idea of how those appointments fall into the contact with the patient. We use text messaging and support for support and accountability in between appointments as needed. And then we are collaborating with our physicians. So if a patient has a medical or in an appointment with a dietitian brings up a concern that is outside of our scope of practice and needs more medical attention, we have the ability within our collaboration, our model, collaborating with the physicians, to be able to refer them or to say we recommend that they make a follow-up appointment with one of our physicians to discuss their concerns. Similarly, if the patient is already working with a physician through Genev, we can also reach out to that physician to ask questions. We share notes in our electronic health record, so that is helpful for referral and again, coordinating that care. Okay, so for how does a patient access a dietitian appointment? So a couple of different ways that they can come to us. So one, if they meet with a physician first for menopause care, and perhaps they bring up their concerns around weight. If the physician may then say, I would recommend you meet with one of our dietitians, and they can put that referral in through our electronic health record, in which case the patient will get contacted by our patient care team to say, a physician, one of our physicians recommended that you schedule an appointment. Would you like help with scheduling? The other option is the physician may say, hey, I recommend this. They can also schedule right through their dashboard. So however, the same way that they link to schedule their physician appointment initially, they can go back and they'll see the option for nutrition and lifestyle care or weight management. Both of those options will bring them to a dietitian appointment. And that's the same way that they can directly schedule with a dietitian. So if they are someone that either has an in-person gynecologist that's managing their menopause symptoms, or they don't have any active menopause symptoms that need medical attention at this time, but they want to meet with a dietitian, they can do that through the dashboard by scheduling either a nutrition and lifestyle appointment or a weight management appointment. And I'll go through the distinctions on each of those. Either way, for either pathway, nutrition and lifestyle or weight management, we're looking at a recommendation of about 9 visits per year at least. Now, this isn't required, and we certainly would not turn someone away if they couldn't commit to that or didn't want to do that. But really, if we think about the lifestyle changes that are often needed to support the health goals that someone may have around their menopause transition, their menopause journey, it takes more than one visit. So we want to make sure that we are setting that expectation so that patients know that really this care is designed for multiple visits. And I'll go through the breakdown of where those 9 visits fall and the rationale behind that. But that this is to support them, to have the best outcomes, to get the support that they need with the care that they're looking for. We divide this up into some phases. So months 0 through 3, we call that our habit forming phase. If you've ever tried to start a new habit, it can take a significant amount of time. And you often have to try different things to find out what works for you. And we want to be with the patient through that process. If you can reach to 4 to 6 months, and again, everybody has different experiences with this, but it can become a little bit more ingrained and perhaps need less support. So we call this our habit maintaining or habit maintenance phase, where they may need less support from their dietitian. And again, I'll go through what that breakdown looks like. But generally speaking, this is how they come to us. This is the different ways that they can access a dietitian appointment and the pathways that they can choose based off of their main concerns. So starting with the nutrition and lifestyle first, that initial visit, like I mentioned, will be 55 minutes. Here, we're going to be goal setting, and talking to them about their goals. What does that look like? What do they want to achieve? And really diving into the details of that, getting to know the patient, starting with to establish that rapport. We're going to review they'll complete an intake form ahead of time. We're going to review that along with their health history and continue to do a comprehensive nutrition and lifestyle assessment and evaluation within that appointment, really getting to know the patient, finding out what their motivation is, and what's important to them so that we can tailor that plan to them and identify the specific action items that they can get started with. Typically, after that first appointment, we're looking at identifying 1 to maybe 3 action items. That it might even be stretching it. Often, patients are coming in feeling overwhelmed. They haven't been able to implement things in the past. That's why they're here. we want to set them up for success. So we don't want to give them a list of 5 to 10 things to do, then they're not able to do it, and then they don't feel successful. We want to start with one small thing at a time and build on that. Again, with this, seeing this as a longer term therapeutic or counseling clinical relationship that is going to take time for them to be able to reach their goals. So the next visit is going to be ideally within about 2 to 3 weeks, and certainly that may depend on the patient's availability, but we want to meet with them sooner rather than later in this case. So 2 to 3 weeks gives a good amount of time for a patient to then implement the recommendations, the action items that the dietitian had set out for them, and then to try it out, figure out what works, figure out what doesn't work, or maybe not even figure out what works or what doesn't work, but rather learn through the process and come back with what didn't work and then work with their dietitian at that next follow-up visit. In that follow-up visit, we're going to review the goals, review the action items, what are the barriers, what can be helpful in maintaining these habits, really talk through those things in that 40 minutes of time. As the patient works through into that 4 to 6 months, again, we're hoping that those habits are forming. And some people they will, some people will take a little bit longer, but again, using this as a framework. And we're going to continue that goal review, action items, barrier identification, supporting those beneficial habits. At this point, if habits are forming more and the patient is feeling more confident in implementing on their own, the cadence may spread out to about every 4 to 5 weeks. And so this is generally speaking what we see individuals, if we encourage them to commit to 6 months. Work with us for 6 months so that you can get the benefit of implementing these changes, get the support, and ideally then that's where the outcomes are going to happen. We can vary around that if needed, but know that when the patient shows up to the appointment, this is what we will present to them as the option that we typically see for them being most successful. As I mentioned previously, there is SMS communication between visits. Typically, this is used for quick questions here or there, maybe sending some resources if a patient needs it. But we want to have the bulk of the clinical care being provided in an appointment. So if a patient does reach out via SMS with a lengthy question or a complex question, we will likely refer them to bring that up in their next appointment, or perhaps if that appointment, say it is 4 or 5 weeks out, they're in the maintenance phase, then we might recommend that they schedule an appointment sooner. Though if anything is complex, we do want to make sure that they have face-to-face conversation, an opportunity for a dialogue, and text communication doesn't always allow for that. So that's really just to be there for intermediary support. In those first couple of weeks, appointments being every 2 to 3 weeks, often that frequency also allows for any questions to be answered within that time, but the SMS is a resource. All right. So the next one here is our weight management pathway. What you'll see here is that it is relatively the same format of visits with the physician appointment inserted here. So I'm going to review this with you so you have an understanding, but know that the pattern of the visits, the time of the visits are all similar, are all the same, and I'll call out the distinctions here. So again, they have that initial visit. It does start with a dietitian visit. We want to make sure that our patients, when it comes to weight management with or without medications, that they are getting the education for the nutrition and lifestyle components to it. So that is very important to us that they have that support and that care. And so we have the patients meet with the dietitian first before going on to a physician appointment. Within that appointment, we're doing the same things as we did last time in terms of goal setting, reviewing the intake, their health history, and doing that comprehensive nutrition lifestyle assessment evaluation and coming up with the nutrition lifestyle plan with their action items. The additional steps here is we will order some labs. So there's a set of 7 labs that we want our patients to have completed if they want to be considered for a weight management medication. And so we will order those for the patient to complete. We will also then refer the patient if after having the nutrition appointment and discussing weight management, they still want to proceed with seeking medication support. We will then put in the physician referral. It is sometimes possible that patients come in wanting weight management support and maybe on the fence about medications, and they can absolutely make this appointment. We can talk through the process, what it looks like, and then they can even still make an appointment with a physician that doesn't commit them to having to get the medications. Perhaps they just want to have a thorough risk to benefit conversation. That's absolutely possible. We want to make sure their goal here is that patients are informed and I feel like they have the knowledge and the information to make the decision on their own that best suits their needs and health goals. So once the patient, if the patient does decide to continue through this pathway, they will get their physician appointment scheduled, and this is with a weight management trained physician, also one of our OBGYN physicians. So they do have that menopausal lens, which is really helpful in this context to understand weight management and weight management medications in the context of hormone therapy where appropriate, or just the menopause transition. The physician will review the labs, they'll have that risk and benefit discussion, and then will prescribe the prescription if appropriate. Our physicians do use the national guidelines for these medications for medical need. So they are looking for a BMI of 30 or above, or 27 or to 30 with comorbidities. So that's something that in the dietitian appointment we will share with the patient, but important for them to know we are not a clinic that is giving weight management medications out to anyone, and especially those that are, if they're only looking to lose a small amount of weight, this usually isn't their first option that we are able to support. So, and then with the follow-up appointments here, we recommend that the patients come in at 1 month after, just to assess for any symptoms or answer any questions, and then at 3 months and 6 months for prescription renewal. And then they will continue with the follow-up visit, framework that I mentioned previously with the dietitian. And so again, continuing to work with the dietitian. If they do get a medication, we're working with them while they're on the medication, helping if there's any digestion concerns, energy concerns, making sure they're meeting adequate nutrition needs, making sure that they're working to include resistance training, physical activity, all of those components that are important anyway, but the importance heightens somewhat with that weight management if they go on a weight management medication. And then still the same in terms of the text communication. So next I'll go through here the strategies when it comes to nutrition and lifestyle. And again, we're going to use this with someone that has that they are coming in for nutrition and lifestyle support, or if they're coming in for weight management support. The nutrition and lifestyle spans both pathways. One distinction I will call out, I should have mentioned on the other slides, is that essentially the weight management pathway is for that individual that wants consideration for a weight management medication. So they have weight concerns and then they want medication support. If a patient does not want medication support and they have weight concerns, it would come through the nutrition and lifestyle pathway. The distinction there again with that weight management pathway is the medication option. Excuse me. All right. Now, looking at the specific strategies to give you an idea on how, as a dietitian, the lens that we look through and the things that we consider. Again, on this slide, this is by no means an exhaustive list. There's a lot of different pathways that we can go down with the patient in each of these areas, and many things that aren't even listed. But to give you an idea and things you can share with the patient when it comes to nutrition, certainly we're going to talk about and work on nutrition needs. So protein gets a lot of attention these days. That will be something we'll look at. Carbohydrates, especially fiber, being a form of carbohydrate, we want to make sure our patients are getting optimal amounts of that. And then the fat and what types of fats and what does that look like. This can then look into how do we support with meal planning or recipe suggestions to help patients to implement recommendations. For some patients, food tracking is really helpful. That's not appropriate for all patients, or some patients don't find it helpful, so it's certainly not a requirement, but it can be a tool that we use. We can do a supplement evaluation. We often have patients coming in on a variety of supplements, and we're able to essentially audit those, look at the supplements, make sure there's no contraindications with any medications or supplements contraindicating each other, and talk to the patients about the importance of third-party testing and verification for supplements if they're going to use them, or sometimes talk about what the evidence is or lack of evidence for certain supplements and help them weigh the risks to benefits, especially when it comes to the cost of those and other things that they might need to support their nutrition. Digestion support, as I mentioned before, can all be a part of how do we optimize their nutrition to then support those other nutrition needs that I mentioned at the beginning of the presentation. Movement is a really important one. And so as dietitians, often we think, oh, you're a dietitian, you just talk about food and nutrition. Well, it's so much more than that, because often, as I mentioned before, when it comes to implementing exercise, a part of being able to do that successfully is often making sure you're fueling your body optimally, appropriately, and at the right times. And so in order to be able to execute a consistent and successful or effective exercise routine, there's a dependency on the nutrition, so there's that link there. Within our team, we do have exercise physiologists that can support and even more specific recommendations. Our team of dietitians is very collaborative, and we share resources as well. So if a patient is working with a non-exercise physiologist dietitian, that dietitian, if there needs to be more specific recommendations beyond physical activity guidelines, which dietitians are trained to educate on and to provide support in implementing. But if there need more specific support or exercise planning or understanding of routines for certain goals, we have with the exercise physiologists on staff, other dietitians are able to say, hey, let me talk with our exercise physiologist and get back to you. So there's a way that we have that collaboration and care within the dietitians as well. And a lot of resources, we have a whole system of resources that we have built out to utilize that have been vetted, and we have areas for resources for physical activity and movement to support our patients in that. And this can encompass all sorts of things. So resistance training, strength training is getting a lot more attention these days, which is fabulous to see. And we want to make sure that patients are executing this in a safe and effective way. Cardiovascular training, so that aerobic training, endurance type training, that is also important. We don't want patients to forget that either, and so we can talk about different strategies and what's appropriate for them. Flexibility, mobility, balance are all aspects of fitness that are important. We can talk about what modalities and make resource recommendations, whether it's helping the patient to figure out within their community what resources may be available. And so that could look like if a patient wants to have in-person exercise, we could talk about, hey, is there a gym that you can go to? Can you go to the gym and ask about the classes they have available? Can you see if they have a tutorial on how to use the equipment? Maybe there's personal training options, so we can guide the patient to explore the options that are within their resources and access. On the other hand, we also have a plethora of online resources we can send to patients, or app recommendations that we have vetted either by our team or have had other patients recommend it based off of their experience. Wearable data integration, lots of information out there and cool things happening with wearables. At the very basic level, we can help patients track their steps and work on increasing and improving those. We can also look at intensity of exercise, heart rate zones, talk to them about what that means, how that supports their goals, and other components to their menopause journey. So that's a way that we can use some other data that they may have available to them. Obviously, this does depend on the patient already having a wearable device, but many people do. So it's something that we can incorporate into the education and counseling that we do. On the sleep side of things, sleep hygiene, certainly evaluating their sleep patterns, and maybe that is with sleep tracking, could be with a wearable device, or just what they know. If they know I wake up at 2:30 every morning and I can't fall back to sleep, or I'm ruminating, those are some things that we can talk about, different strategies to help with that, as well as making sure that they're getting optimal um, medical support on the menopause side. Certainly, sleep is something that can also be addressed with an appointment with one of our physicians. So, if they aren't already seeing a physician for that, we can direct them and refer them to that. If it's a case where they are, maybe we may recommend taking maybe a reevaluation of the treatment approach and to see if there needs to be any tweaks or changes. Many patients are taking supplements, whether it be melatonin or magnesium or other ones out there for sleep. And so we can assess what they're taking, if it makes sense, if it's appropriate amounts, appropriate brands, safe, effective, all of those things we can take a look at and have discussions with the patient on. And then finally, here, the last component that we have is mindfulness or stress management. And so, certainly, stress plays a role in our lives. And I always remind patients that during the menopause transition, menopause is a stress on the body. It is a normal and natural stress, but to go from having regularly cycling hormones for many, many years to then all of a sudden having sporadic hormone fluctuations as they're decreasing, the body's working to adapt. And so that adds another element to the stress. And then if we add in life stress, family stress, work stress, world stress, that system is under a lot of stress and there can be significant consequences to that. The good news is there's a variety of different strategies that we can support patients in implementing, and even small changes in this can make a big difference. And so that's another area where dietitians may offer support depending on what the patient needs. And this can be something like a mindful eating practice, which can also have other benefits around digestion and nutrient consumption. Breathing techniques, really simple breathing techniques, to maybe more complex, depending on what the patient's experience, needs, and desires are. We can provide a variety of different stress management resources, again, from our vetted resources that we have to be able to do that. And then for some people, mindfulness or meditation support, whether it be through a yoga practice, or their own deep breathing, an app, a guided meditation maybe that they have available in the community. All of these things can be used to integrate. So this is an example, again, not exhaustive, plenty of other things that we implement, and we really try to work with that individual patient. Each individual dietitian comes with their own experience and skill set, so they use that lens, and then we're collaborating. I like to call it like a hive mind. We bring all of those together, and then that grows other ideas as well as cross collaboration. So with that intention of providing our patients with the best resources possible, among all of these things that we're offering. So all of this are great resources, and often for some patients, that's what they need. That was the missing link. They needed a few key easy recipes, or they needed the nudge to go to the gym and start their membership back up again, or a sleep strategy or wind down routine to support sleep, or that deep breathing technique during times of stress. So in some cases, those are the resources that they need to implement and get them on their journey. In most cases, it's a more complex process, and those resources and the education and the guidance and the counseling is absolutely important and helpful. But what really needs to be done is that support around health coaching and behavior change. So, dietitians are also all trained in behavior change, and I love the science of behavior change. It's absolutely fascinating. We see it in other areas of our lives. There's a lot of psychology. I mean, it plays into marketing and leadership and business. But when we come into the patient interaction, that relationship, and looking at how do we facilitate that individual to drive themselves to change their behavior, so that they are, how do we help them, if we're going to help them make sustainable, consistent change long term to get those long term outcomes, we really need to be working at and implementing strategies to support them in getting to a place where they can do it themselves. Because even though we may stay with them for those 9 visits, those 6 months, we have patients that have been with us for several years. likely we're not going to be with them for the rest of their life, but we want to set them up for success for the rest of their life. And that's what we can do here. And so here are the components here when we look at being able to provide that behavior change environment. Or the scenario to support optimal behavior change. We want to provide that support. We want to hold them accountable with support, and it's supportive accountability, not punitive accountability. We want to help them learn what works and lean into that and support them in implementing that more. And then we also, sometimes the learning is in what doesn't work. And so if a patient learn some often, that first visit, they're super motivated, they want to get started, they say, it's going to work for me to meal plan on Sundays for the entire upcoming week. Well, when they come back, often it's like, that's what I thought. But then all of a sudden we had, my kid had an engagement that we had to go to that came up last minute. Well, that's life. So how do we help them understand that, okay, that's what happened. It was a blip on the screen. What's the backup plan? Because likely that's going to happen again. And so that what doesn't work, it often can be an even more powerful learning. And we're there to reframe that. Often they come back and that feels like a failure. That's not a failure, that's a learning. And that reframing then facilitates greater behavior change moving forward. This is a self-discovery journey, and especially for our patients going through that menopause journey, often they describe it as, I have a lot of patients that say, I feel like I'm looking at myself through a screen and I kind of don't recognize that person on the other side of the screen, but I know it's me. And so we're doing this self-discovery journey. We're along this journey with them and helping them to see that. And that adds another layer of complexity. And so being able to help them identify that, validating it, making sure that they know that that certainly is true and real to their journey. And then sometimes that just allows them, gives them that permission to implement, to be able to implement the strategies more confidently or figuring out what works. And often it's a discovery of and recognition that what has worked before isn't going to work now because things are different. Physiology is different, life is different, body is different. And so we have to figure out those new strategies to work with them. And ultimately, we want to improve that quality of life. And as much as, all of the things I mentioned on the slide previous can improve quality of life, don't get me wrong. The ability to build confidence in someone implementing on those things on their own sustainably and consistently, that sense of accomplishment and being able to do that has dramatic impact on quality of life. And so that all comes from the behavior change piece. And so it's a less of just giving information. It is really figuring out the art within the science of how to support each and every individual implement the habits that are going to be best for them, that they see are going to be best for them in the best way possible, and helping them to identify it on their own. So fascinating and fun for our team to do, and it takes time. And so this comes back to really wanting to make sure our patients know coming into it, hey, this is going to be several visits. Ideally, you're with us for 6 months, ideally more in some ways, so that you're really constantly just working on. And if you get one habit established, we want you working on the next one and the next one and feeling really confident in that. So looking at this, this is an integrated care model where, it does say hormone therapy, lifestyle, nutrition support. Not everybody is going to need hormone therapy, so that certainly isn't a requirement. But when we have that medical care and the nutrition and lifestyle put into place, we see kind of this magic happen. And so that's what when we have those patients that this really works for, it's fabulous to see the impact and with it all. And so here's an example, that we can put into place. We want meal planning, exercise routine, sleep and stress management, like we talked about, medical weight management if needed. Again, that's not for everybody either. But ultimately, this is a holistic, patient-centered approach. We're meeting the patient where they are, identifying their goals and their needs, and collaborating that care, medical, nutrition, and lifestyle together to support them on their journey. This addresses both biological and lifestyle determinants of health. So we're looking at all the different components, again, the physiology aspects, as well as those lifestyle and nutrition. This can enhance patient satisfaction and adherence. They have the dietitian to work with them, to guide them, to ask questions, to be able to provide the support, to provide the encouragement, to give them the space to process the things that they're going through and the challenges that they face, and the opportunity to reframe and start again, or not start again, build upon their learnings. And then this is a prevention-oriented personalized care. Each and every patient needs something slightly different, and we can provide that to them in this care model. And ultimately, that's what they deserve, to be able to get the support and the health outcomes that they want. All right. Hopefully that provides a little bit more context to our nutrition, lifestyle, weight management offering through our Genev dietitians. Feel free to reach out with any questions.